Any better? A little better, right? And now it's still better? No.
How about now? It's good, it's good. Don't be confused.
Got it.
Okay?
Okay, we got it.
Good evening, everyone. My name is DR Twerski, and I'm a friend of the 12-Step Program. Yeah, my career started out as a rabbi. And I knew nothing about addiction. They don't teach you that in yeshiva, you know? Then I went to medical school for 4 years. And I learned about all kinds of diseases. I learned about diseases that a doctor never sees. But I never learned anything about addiction. Although, probably more than 50% of people who walk into a doctor's office are addicted to something. But they didn't teach that in medical school. Well, then I went into psychiatry. In 3 years of psychiatric training, not one lecture on addiction. Which means that if you go to see a psychiatrist, unless that psychiatrist has somehow gotten an interest in addiction, he probably knows nothing about addiction. And when the psychiatrist knows nothing about addiction, he can screw things up, you know? But something happened back in 1961 when I had a client, and I can't tell you the whole story because it will take another half an hour at least, a woman who was sober, and I asked her, well, how do you stay sober? Because I knew psychiatry had nothing to offer. And she said, well, I go to meetings of Alcoholics Anonymous. Well, in 1961, nobody knew anything about Alcoholics Anonymous. This was before Betty Ford and before Jason Robert and before Elizabeth Taylor and all that kind of stuff. So I said, well, who does the treatment at the meetings? Well, she says, sometimes we have discussions and sometimes we have a speaker. I said, Isabel, do you have psychologists there? She says, well, there's one psychologist who comes around, but he's still drunk most of the time. I said, Isabel, something is happening at those meetings that keeps you sober, and I want to know what that is. Can you get me into one of those meetings? Oh, sure, she said. So in 1961, she took me to my first AA meeting. This is now 2010, so I have 49 years of attending AA meetings. Even though I never drank and I never used and I never gambled and don't have an eating disorder. But you see, I recognized at that first meeting that the 12-step program really has nothing to do with alcohol or drugs. What the 12-step program has to do is with a character transformation and a character refinement and enabling a person to become a better person, getting rid of one's character defects. And I said, well, wait a minute. I need that too. I mean, I got some character defects. You know, some people ask me, how long do I have to keep going to meetings? I said, only as long as you have character defects. When you no longer have character defects, then you can stop. But you won't have to stop because you'll be dead. You know, nobody achieves perfection, and since a human being can't be perfect, we all have character defects, right? Fortunately, I think that my character defects are now much less than they were 49 years ago, but I still got character defects, so I still go to meetings. And I realized that working the program can make me into a better person. I remember attending a meeting in Pittsburgh where a gentleman was celebrating his 25th anniversary, and he got up and he said, the man I once was drank, and the man I once was will drink again. It's just a one-liner. But he's saying, as a result of this program, I am no longer the person I was. But if I go back to being the person I was with all of the shtick and with all of my manipulations and all my dishonesty, whatever, I'll end up drinking again. So what happens is that sincere working the program enables you to become a much different and a much better person. The only disease I know of where recovery makes you better than you were healthy to begin with. Now, in Pittsburgh, I was chairman of the president of the Allegheny County Medical Society. 2,000 doctors. Okay? Some very, very fine doctors. But when I had to choose a doctor for myself, or for my wife, or for my children, or for my grandchildren, they all came from the program. Now, first of all, it was a very selfish reason. 1 out of 12 doctors is addicted. Okay? And that's, for me, that's too big a chance to take. Okay? I want to know that my doctor who's treating me and he's operating me or whatever is dealing with the full deck. And the only way I know that is if I get a doctor from the program, right, and he's attending meetings. Well, somebody says, well, what would happen if your doctor stopped attending meetings and started drinking again? I said, you better believe I would find that out before 48 hours are over. Right? Because I got an FBI system, you know. I was hospitalized once for diverticulitis, and my doctor said, just as a precaution, I want to call in for a surgical consult. Well, 6 o'clock in the morning, the surgeon walks in, and he says, good morning, Dr. Twerski. I said, oh, good morning, John. He said, you did a good job on me. I said, John, if I hadn't done a good job on you, you never would have walked into this room. So you see, what happens is the program provides a vehicle for character transformation. Let me show you a simple example why it's so good. Here's a simple experiment to do. Take a stenographer's pad and stand on a busy street corner. And as people go by, stop them and say, pardon me, ma'am, or pardon me, sir, I'm doing a survey. Would you have a moment to answer a question or two? Well, some people will stop. Yes, what is it you want to know? Have you ever made a fearless moral inventory? What's the reaction? What are you, a missionary? And they'll walk away. Every once in a while, somebody will say, oh yes, I'm involved in a program where we're required to do a fearless moral inventory. The only people in the world who do fearless moral inventories are addicts. And the only way you get to know who you are is by doing a fearless moral inventory. Which means that 99% of people in the world can be living 80, 90, 100 years and die without knowing who they were at all. Because the only way to get to know yourself is with a fearless moral inventory, which is not done once. My sponsor made me do it 6 times. By the way, I had a hell of a time getting a sponsor. I didn't drink, they didn't know what to do with me.